70 kilometers north of Hanoi, Vietnam's capital city, lies Thai Nguyen, a center of commerce, education, and culture for the northern mountainous regions of Vietnam. With a population of over 300,000, it is a fast-growing city that is home to diverse ethnic minority groups. Thai Nguyen is well known throughout Vietnam and abroad for its bittersweet green tea grown throughout the province. It is also home to the legendary Coke Lake, a popular weekend destination away from the busy life of Thai Nguyen City and surrounding areas. With mountains to the north and Hanoi to the south, Thai Nguyen has developed into the urban gateway from Hanoi's expanding population to the beautiful and ethnically diverse northern highlands of Vietnam. While tea may be the most famous product from Thai Nguyen Province, the 8 colleges that make up Thai Nguyen University have made this city well known to students throughout Vietnam for its higher education. Among these is the Thai Nguyen University of Medicine and Pharmacy, the only medical school in the northern provinces of Vietnam. Founded in 1968 as Bac Thai Medical University, the school continued to grow and in 1994 became an official member of Thai Nguyen University. Over the years, the University of Medicine and Pharmacy has developed into a leading medical institution in Vietnam and has made a great impact on the health and overall well-being of the people of Thai Nguyen and all northern provinces. Thai Nguyen University's mission encompasses 4 distinct objectives. 1. To train undergraduate and graduate health professionals for work throughout Vietnam, particularly in the north. 2. To conduct scientific research and foster technology transfer to hospitals and health centers across the underserved areas in the mountainous north. 3. To provide people living in the northern provinces with primary health care and health services. And finally, 4. To broaden and expand cooperation with international schools and hospitals. After 44 years of development and progress, Thai Nguyen University has become an invaluable resource in Vietnam, continually training high-skilled health professionals, supporting and promoting important health research, while building up the capacity of community health programs throughout the north. There are 7 main departments within the school. These include general studies, basic medical sciences like mathematics, biophysics, and biochemistry, public health, pharmacy, nursing, clinical departments such as pediatrics, obstetrics, and internal medicine, the Department of Subspecialties, such as infectious disease, neurology, psychiatry, and traditional medicine, and finally, graduate studies. Each department has its own unique curriculum that prepares students with the theoretical foundation to become well-trained professional health providers after graduating from the university. A staff of over 400 experienced lecturers, highlighted by 32 PhDs and 170 master's degrees, work throughout the year to effectively train and teach all students. Many of the university's lecturers have graduated from prestigious education centers across Vietnam, as well as overseas universities in South Korea, Australia, Japan, Thailand, China, and the United States. With a diverse set of knowledge and skills, they are equipped to explore and promote new areas of research and teaching methods. The university is committed to providing an exceptional learning experience for its students, and frequently invites senior professors and doctors from other universities, both inside and outside the country, to lecture the students. One of the university's most distinctive assets is its integrated training program, closely aligned with the interprofessional curriculum of each department. Through a combination of classroom learning, clinical experience at university-affiliated hospitals, and simulations in the laboratory, students here gain the skills and knowledge to become superb scientists, compassionate communicators, and skilled practitioners in healthcare disciplines. Students are prepared for the most modern and advanced medical practice through practical clinical training at Taiguin General Hospital, as well as in the 60-bed university hospital located directly on campus. At the General Hospital, just minutes down the road from the university, students are exposed to high-tech services in internal medicine, surgery, obstetrics, ophthalmology, and neurology, among others. The university hospital on campus, which provides medical services to Taiguin residents year-round, provides an ideal space for clinical training, building upon the professional capacity of both staff and students. Undergraduate qualification is a major strength of Taiguin University and includes training programs in general and preventive medicine, dentistry, pharmacy, and nursing. With a PhD program in social hygiene and health management, and master's programs in internal medicine, surgery, obstetrics, and public health, the university offers a wide selection of degrees at the graduate level. There are also 12 residency and specialist certificates offered in several subjects, including anesthesiology, psychiatry, family medicine, dermatology, and pediatrics. In order to meet the province's demand for more technicians, the university is also implementing 3-year training programs in food safety and school medicine. To date, the university has trained over 15,000 general medical doctors, 400 pharmacists, 300 bachelors of nursing, thousands more first and second degree health specialists, and over 200 PhDs and Masters of Science in Medicine. Along with the practical skills gained at nearby hospitals, established research centers provide students and staff the opportunity to gain a deeper understanding of the most important health issues in northern Vietnam. The Center for Research of Mountainous Health, Diseases, and the Environment has conducted several studies looking at the health status of populations in mountainous regions and the impact of the environment on people's health. The Center for Herbal Medicine has focused specifically on the effects of medicinal herbs and traditional medicine utilized by ethnic minorities, in an effort to make these important products more accessible and to determine the ideal methods for their use. Finally, the Family Medicine Center's objective is to build a network of primary care physicians at the community level. A variety of clinical and subclinical research has been carried out on many subjects. These also include tropical diseases, the integration of Western and traditional medicine, and nutrition. With the university's extended network of staff and alumni throughout the northern provinces, students at Taiguin have the unique opportunity to research and work in the field of community health in northern Vietnam. For those interested in rural medicine, Taiguin offers an incredible opportunity to train at a university while being exposed to the realities in the field. Over the years, the university has collaborated with many international partners in important research and capacity building projects. Some examples of work done in the past: a Swedish-funded project on community-based education, work supported by the Dutch government on strengthening community orientation at medical faculties in Vietnam, a project titled Support Training for the Family Doctor funded by the China Medical Board, a project on reproductive health care sponsored by Pathfinder International, and a capacity building project for northern regions sponsored by the Rockefeller Foundation. The university has also collaborated with the Population Council to conduct research that aims to provide evidence-based family planning information to contribute to the country's efforts to attain universal access to family planning and safe abortion counseling and services. A project currently underway is a collaboration between Emory University and the Material Institute for the Advancement of Human Nutrition of the United States and the Micronutrient Initiative in Canada. This 4-year randomized controlled trial aims to address the micronutrient deficiencies among vulnerable women and children and to provide evidence to guide policies designed to reduce the burden of anemia and improve maternal and child health outcomes in resource-poor settings. Taigwan University has developed working relationships with a number of universities overseas, ranging from institutions in China, Taiwan, Thailand, Japan, Netherlands, Australia, Canada, and the United States. In an effort to improve the program locally and broaden expertise, the Department of Nursing has connected with the following programs on staff trainings and student exchanges: Barapa University and Narusan University in Thailand, Maastricht University in the Netherlands, Shenzhen College of Management and Medicine in Taiwan, and the CEC in Japan. The university has also recently partnered with Columbia University in New York in research and English language instruction. In accordance with the university's mission to serve the diverse communities of northern Vietnam, the majority of students at Taigwan University come from the northern mountainous provinces and from many different ethnic backgrounds. Many scholarships are even provided to encourage and enable those from low-income families to attend. Students come to Taigwan University for its focus on the high-quality clinical experience, modern facilities, expert faculty, and a vibrant student community which fosters an open learning environment. While attending the university, most students participate in research studies and community health projects with members of the faculty. During school holidays, students often return home to assist their families, volunteer in community projects, or engage in other productive social activities, demonstrating their commitment to improving the lives of people throughout the northern region. Students form a close-knit community through activities both inside and outside the classroom. They participate in a variety of extracurricular activities, ranging from dance and sports to singing and language clubs. These shared experiences help to create strong social networks and foster a dynamic community where students support and learn from each other in many different ways. Since its founding, Taigwan University has trained thousands of physicians, nurses, pharmacists, and technicians who now make up more than 85% of the medical service providers working in the northern provinces. As Vietnam continues its rapid social and economic growth, Taigwan University of Medicine and Pharmacy will play an important role in bridging this growth and success by contributing to improving the health of the Vietnamese people. Plans to build new facilities and dormitories are already underway as the university looks to the future to meet the ever-growing health needs of the diverse communities living in Vietnam. With great opportunities to research and work in community health and a strong emphasis on collaboration with institutions from around the world, Taigwan University provides students with an extraordinary learning experience for the 21st century.